Building a better Bay Area. Moving forward, finding solutions. This is ABC 7 News.
Hi, everybody. I'm Dion Lim, and you are watching Getting Answers. We're live on ABC 7, Hulu Live, and wherever you stream. Now, what we do is we ask experts your questions every day at 3 to get you answers in real time. Lots to get to today. We will look into the trash hauling giant Recology. Our partners at the San Francisco Standard launched an investigation into overbilling customers and the connections to the San Francisco City Hall corruption scandal. But first, we do hear an awful lot about the chaos and the staffing issues in hospitals. So let's take you to the ground floor and bring in Dr. Maria Raven. She is an emergency doctor at UCSF. She is also here to answer all of your COVID questions. Make sure to ask those at facebook.com/ABC7News. Dr. Raven, thank you so much for being here. I'm surprised you could, I don't know, escape the ER for a little bit.
Oh, no problem. Thanks for having me.
Yeah. Well, right away, let's talk about this because Dr. Fauci is now saying Omicron will ultimately find just about everybody. I mean, how are people supposed to take that quote? Are we supposed to think of this as the common cold?
Well, it's a really great question. I think that we are probably starting to approach that. I think for some people, Omicron is a little bit more than the common cold, but for most people, it's not presenting a severe enough illness where you would need to go to the hospital or anything like that. So it is unbelievable because it does evade our vaccines in terms of just the infection component. A lot of people are getting it, and everybody I know that's sort of been quote unquote doing everything right is doesn't shield you from Omicron, unfortunately.
Yeah, that seems to be what some people are chiming in to say. Laura Lynn Smith writes in to say it is mild, this Omicron variant in comparison. Chad saying good afternoon to everyone. I do want to ask you about this because you touched upon vaccinations. What do people who are fully vaccinated and perhaps boosted do? Do they keep going to restaurants? Do they keep living life normally? I was shamed the other day when my friend said, "How dare you try to go out to eat?"
Oh, no, I don't think that you need to be shamed for that. I mean, it's really a lot about what your own personal risk tolerance is at this point, and just understanding that if you're an otherwise healthy person who is vaccinated and boosted, and you go out to eat, there is a chance that you will get Omicron. There might even be a good chance, but there's also, depending on when you were boosted. If you're boosted in the last 3 months, it's much less likely that you would probably get it. But if you're okay with that, you might get a little bit of a cold. You might get a little sicker, like a flu. If you have zero desire or zero risk tolerance, then don't do that. But if you're okay with maybe getting this virus that everybody is getting, then if you're vaccinated, boosted, otherwise healthy, I think you can kind of basically go about your life and just be smart.
Yeah. I do want to skip ahead and ask you a little bit about your experience in the emergency room, because we've been hearing this term an awful lot, at capacity, and I do want to ask you what that means, because it doesn't necessarily mean that the hospital is overrun with COVID patients.
That's right. So the hospital is not overrun with COVID patients. We're not at the point where we were, earlier in some of the other surges. What we are seeing in the emergency department in particular is just a much larger number of patients with Omicron. So we're seeing much larger numbers than ever before of people either that are coming in for symptoms and testing positive or incidentally found to be positive. We test them because they're going to be hospitalized or for other reasons. And so those numbers are quite large, but we're not seeing as much of very severe illness where we have to hospitalize these folks. Many of them can go home with supportive care. But the hospitals are, we do have COVID patients, a number of them. Even if you are hospitalized with COVID and not for COVID, we still have to take isolation precautions. And then we have all the other patients that are coming in to see us for all their other medical problems. And there are also a lot of those.
I want to take a moment to debunk something. A comment from a user named Matt Shea on Facebook says, by telling people everyone is going to get it is a scare tactic. Sorry. Do you have a response to Mr. Shea?
I don't think it's a scare tactic. I mean, certainly probably not 100% of people are going to get it, but a lot of people are getting this virus. And I don't think it has to feel scary, again, if you're otherwise healthy and vaccinated. For most people, this is a relatively mild illness in the age before COVID, when all of us remember that sometimes we got sick. And so I think the reality is a huge number of people are being infected with Omicron. And, you know, for most people, it's going to be okay.
A nice comment for you, Doctor, is from Cicely Ross saying, I like this lady. She is telling the truth. So I'm glad you're currying favor with our audience. I do want to read a couple more questions. One coming in from Daniel asking, is the booster stronger after a few months?
Stronger after a few months? No, the booster is weaker after a few months. So probably the first 3 months after you're boosted is when your antibodies are going to be the highest and give you the most protection against acute infection from COVID. Most of it's Omicron right now. After that, you kind of go back to your sort of baseline, or you start to go back to your baseline immunity that the vaccine gives you. And again, that does protect you against severe illness, hospitalization, and death. But what the vaccines don't do as well, which we've always known, is they don't necessarily protect you against getting infected, period. And especially with Omicron, it is just doing a very good job of evading our vaccines in terms of infection. And that is why so many people are contracting it.
If we can take a moment to pivot to the issue of masks, because it's something that many of us have noticed here at the station, that even out and about in San Francisco, we're seeing people, and really across the state, wear a mask outdoors. We had been told for so long that, you know, with social distancing and being an outside setting, the risk is quite low. So what is your recommendation? Should people be wearing masks outside?
I do not. And my children are so used to wearing masks that they sometimes wear their masks outside. And I always tell them, guys, there's no outdoor mask mandate. It's okay. So I think, you know, depending if you're congregating in a really crowded outdoor space, maybe you would want to wear a mask. Again, it's much lower risk because, you know, the outdoors is very well ventilated. There's a lot of airflow. That's why we have really not thought of it to date as a disease that's contracted outside. Again, Omicron might be a little bit different, but by and large, if you can keep your activities outdoors, you're going to be safer.
Okay, that's a nice guideline to have. And speaking of those masks, we all have heard about these mask shortages, certainly at the store. We are seeing empty shelves. If people cannot get those N95 masks, what is the next best kind? Are we talking about surgical or surgical and cloth? We're seeing a lot of people doubling up now.
Yeah, so I think, again, this is based on your risk tolerance and you're feeling like you do not want to get Omicron under any circumstance, which for most people, it's just like many other viruses. I think an N95 is probably not necessary if you're just, you know, an average person walking around town. If you can't get your hand on one, do not despair. I had to pay a lot of money to get even a few N95s from Amazon because they're going to be required at my kids' schools. Surgical masks do a great job. So if you have a surgical mask, that's fine. Cloth masks probably don't do as well. So if you're going to wear a cloth mask, I would double up, or you can always double up with a surgical mask. It offers very good protection.
Okay, we have so many questions that are coming in. We are going to get to them in the commercial break, so stick around, everybody. The conversation continues on facebook.com/ABC7, and we will be back after this. Okay, wow, these are coming in fast and furious. Doctor, I think you're doing a great job because Daniel wrote in, we have a message from, bear with me here, Melanie wants to know, so if a family member has it and is isolating as best they can, 5 days later, should they test? Might it still be in their system?
Such a good question. And I can assure you, I am going through this right now because my son is COVID positive. And he's sort of hanging out downstairs because we're fortunate enough to be able to have some space where he can isolate a bit. So the CDC guidance right now, as some people know, has changed so that if you're COVID positive, you need to isolate for 5 days. And then they say you can go back to work. And they didn't actually put any testing guidance into that new recommendation. And I think it's because no one can get tests. And so they didn't want to make a recommendation that people couldn't follow through with. So what I'm doing is if at 5 days, the person is symptom free, they've isolated for 5 days, no more symptoms, and you have your hands on a test, then you can go ahead and test. If you still have symptoms or you have a positive test after 5 days, then we're into that 10-day prior period that was recommended for isolation. So let me simplify. Yeah. If you have tests and you have been COVID positive, at 5 days, if you have no more symptoms and you want to go about your regular life, test. If you still have a positive test, you should probably still continue to isolate. If by 10 days you still have a positive test, go about your life. So any negative test before 10 days, you could sort of view as like a get out of jail free card. But if you don't have any tests and you're asymptomatic after 5 days, and you can go back to you can stop isolating, but you just need to wear a mask till the end of the 10 days.
Got it. Dr. Raven, we're about 10 seconds out. Do me a favor. Can you look at the little camera? There we go. I think that'll look a little bit better. Okay. Thanks. We're in this new Zoom world still. So, okay, here we go. Thank you all for staying with us. We are back with Dr. Maria Raven, an emergency doctor at UCSF. And what we want to do this block is talk about what you're seeing in the ER and really what life is like there at UCSF. Because, I mean, bless you for doing what you do. It must not be easy with this influx of people coming in.
Yeah, thanks so much. Well, I worked Monday night and we're very, very busy. Ambulance traffic throughout the city is actually up 20% from prior years. It's very, very high over the past week or two. So we're getting a lot of ambulance traffic with a lot of sick patients coming in, not necessarily for COVID, just with lots of other things. Like I said, our volumes are starting to go up in the emergency department, and we are having a lot of people come in with COVID symptoms that want to be tested because they can't get their hands on rapid tests anywhere else. So we do have a large number of people that are coming in wondering if they have COVID to get tested. Obviously, the emergency department is not the best place to do that, but I do understand people sometimes feel desperate. They can't get their hands on a test anywhere else. We do have to have our COVID positive patients, unless they're acutely ill, wait outside because we have no other space for them to wait. So we have canopies outside with heat lamps and blankets and some providers that sort of go outside to see patients there. So that's what it's looking like right now.
Oh my goodness, that reminds me of school classroom shortages where there are those, annexed buildings that are kind of stuck onto the main school building. Boy.
That's right.
What a
That's
sight.
Right.
What a sight.
Yeah.
Before I get to more questions about the ER, I do want to get to Kristen because she writes in with a somewhat serious question that I think she has been trying to get through to someone about. What is the reality of possible death for an immunocompromised person due to Omicron? Why don't we all wait until the surge is over before going back to school? She has an underlying condition, it sounds like, and is quite worried.
Sure, and I hear that. I think that if you're immunocompromised, depending on what type of immunocompromise you're talking about, we do know that people that, for example, have had an organ transplant and are on immunosuppressive medications or are being treated for cancer with chemotherapy response, even if you are vaccinated. So I do think that if you are one of those high-risk people, during this time, while the vaccine will probably be pretty protective for most people, you would want to be a little more cautious during this time and kind of hold out for a couple more weeks until this surge passes, if you're concerned that you're not having a good response. And if you're unvaccinated, then yeah, you're at much higher risk for hospitalization. Yeah,
that was a great question, Christine. We appreciate you. Thank you for trying time again to get your question answered.
What I would say about school, though, is that the data show us from all of COVID that actually staying in school is protective. Your kids have been less likely to get COVID, at least prior to Omicron, during other times of schooling. It's actually been safer for kids to be in school. And I really firmly believe that the benefits of being in school for kids outweighs any risk of transmission. Kids are vaccinated. Many are boosted, teachers are vaccinated and boosted, and everyone's wearing PPE. And we've just really done a lot of harm to our kids by closing schools.
Yeah, we have covered that extensively, the mental health effects, among other problems that these young people are dealing with, on top of the stresses of being in school. So that makes so much sense. I do want to get back to what your experience has been like, because you touched upon how there are people who are going to the ER just to get tested because they feel stressed. And yeah, I think that's something that we can all relate to, feeling kind of desperate to get these tests. But what is the message that you'd like to send? I mean, when should people really be going to the ER when it's COVID related?
Yeah, so I think most people, again, that come in wanting testing are not that sick. They have cold symptoms. Some are a little sicker, maybe a fever. You know, I would say the time to go to the emergency department is if you feel like you need acute medical care. We are here for you. You know, we see everybody that comes to us, and we're happy to see everybody. Not everybody is always that sick, and that's okay. But if you do come for a test and you're not that sick, we have a way that we have to triage people. So all the people that are very acutely ill are kind of seen first. And what that means for some of our patients that are waiting for a COVID test that aren't that sick is that they end up sitting outside for a couple hours, unfortunately. And so my son just tested positive, I may have mentioned, and I didn't have any rapid tests left myself. So I texted a bunch of friends, and someone came through for me. But yeah, it's tough out there. Unfortunately, that's the state that our country's in. I'm not sure how we got there, where we don't have adequate access to rapid tests. It's really a shame.
Yeah, and we're covering that extensively as well, not to mention the staffing shortage and how these California healthcare workers are being told that if you are asymptomatic, you can indeed come to work. What are you hearing from, I suppose, other medical professionals? I mean, do they feel comfortable with this, or is this more so a response of just how serious things are and you got to do what you got to do to get people care?
Oh, yeah. So I think so at UCSF and largely in the Bay Area, since we have such high rates of vaccination, I would say most people aren't at a critical enough staffing shortage that they would implement that new recommendation from the California Department of Public Health. However, there are lots of hospitals that are in that situation where they simply cannot operate because they don't have the staffing. And my thought on that is that, again, if you are vaccinated and boosted and you have COVID, but you're asymptomatic and there are severe staffing shortages at your hospital necessitating more people on duty, that it is fine for you to go to work with an N95. You know, I know it's controversial, but, you know, even before we had vaccines, just with our PPE, there were just minuscule numbers of provider to patient transmission documented. And so now not only do we have our PPE that we know works, but we also have our vaccines, our booster shots. And so I think as long as we're smart about it, it's much safer to have those folks go back than to leave people without providers.
That would make a lot of sense. I know we only have a few more minutes, but I wanted to let everyone on Facebook know that we see you, we are reading your questions, and I want to get to as many as possible. Tree writes in to ask, has there been any news of new variants, and are they weaker than Omicron? Do you hear of any buzz?
Not really. There was some buzz about some Deltacron variant for a little bit and something else in another country. I think the reality is there will be another variant after Omicron. I think it's very difficult to predict, but I will say that I'm not a virologist, but the natural sort of evolution of a virus is it wants to infect a lot more people. And by doing that, it doesn't want to make the people it infects too sick or kill them, because then it can't replicate. And that's why viruses get milder and milder as they evolve. And so my hope is that the next variant, you know, will be, you know, as mild or milder than Omicron. And again, this is unfortunately something we're going to have to learn to live with.
All right, 60 seconds left. Debbie is asking the question, I was boosted at the end of August. Should I get another boost?
Well, great question, Debbie. I think that depends. You know, you were boosted long enough that your antibodies for acute infection will start to go down. But I also think we have to think to ourselves, what is the end game here, right? So if you're immunocompromised in a serious way, then I think it's reasonable to think about getting another boost. If you're an otherwise healthy person, then I think we kind of have to, again, come to terms with the fact that it's highly likely that we're going to get this, but we're not going to get that sick. And, maybe we don't want to go and get boosted every 3 months, every 6 months. And the initial immunity we have from our vaccines, the original vaccines, is pretty good.
Dr. Raven, you've been great. Lots of information shared and certainly many more questions to go. Hopefully we see you again. Good luck in the ER when you go back.
Thank you so much. I really appreciate it.
All right, coming up next, another investigation into the trash hauling giant Recology. This one is over overbilling customers and how it's all connected to the San Francisco City Hall corruption scandal. Stay with us. We are still live on Facebook.com/ABC7 News. We are in a commercial break. All right. Well, thank you, everyone. Wow, there were a lot of questions to get to. I wish we could have gotten to everyone. But like I said, I just want you to know that my producers and I are all looking through them as we are listening to the guest that is on screen and also paying attention to this iPad, which is loaded with question prompts, things like that. And also, I'm getting text messages from people I'm trying to do stories with. So we always appreciate you chiming in, especially so robustly. Saying hello to Try Again, also to Cruss, Liviand, and Sophie. Hopefully we can do this again soon. We will have another medical expert on our show. And a reminder, if you appreciate and like this format, make sure to give this post on Facebook a click of a like, and then also share it if you want to make sure that your friends and family or people in your network have the access to this as well. So our next guest, I'm very excited to speak to because we have not spoken to our new media partner. At least I have not personally. I know my colleague Kristen has during her time on the show, but it's always nice to have another media partner working on projects that we necessarily can't get to. I know for me, I have a pipeline of stories that I'm working on at any given time. So to have a media outlet that we partner with that can have a more longer form investigation is always really welcome. If you're curious, I am Dion Lim TV on Facebook, Instagram, and Twitter as well. Please do follow me. Ask me any questions that you have. Pretty much an open book. If you're going to be a bully, though, I will not answer your question. I'll just ignore you and click delete. So here we go. We're going to go back on the TV in just a couple seconds. Here we go. Thanks for sticking around. That's right, Douglas. Trash hauling giant Recology has already admitted to overcharging San Francisco residents by nearly $95 million. Now there's a new investigation over more overbilling. This time it's being tied to the City Hall corruption scandal. Joining us now to talk all about it is Michael Barba, senior reporter at the San Francisco Standard. And before we get into it, I want to let everybody know that they're our new partner focused on highlighting issues and stories with insightful reporting on all things San Francisco. So thank you for being here.
Thank you for having me.
Okay, let's back up. For anybody who is not familiar, what happened back in March?
Well, last March, what happened is Recology admitted to overcharging San Francisco customers something like $95 million in excessive rates for garbage collection.
Okay, and can you tell us a little bit more about how much alleged overbilling there is in this case this time around?
Yeah, so we don't quite know yet. What we do know and what we learned this week is that the controller's office is investigating additional potential overbilling. And one supervisor, at least, Aaron Peskin, is convinced that it could be as much as another $100 million. But there's still an investigation that's ongoing. And the controller's office has actually requested documentation from Recology going as far back as 2016.
Now, does this necessarily, do you have information as to how much it trickles down to the consumer?
We don't know at this point, but last time with the $95 million overcharging, that was part of a settlement with the city attorney's office that was returned to the consumer. So these were dollars that were coming out of people's pockets that shouldn't have, essentially, and were given back, or at least Recology agreed to start giving them back as part of this settlement last time.
I see. And in regards to Recology themselves, being a reporter, oftentimes it can be very hard to get large companies on the horn responding. Has Recology said anything about this most latest incident?
Yeah, they have. I mean, what they've said is that they haven't seen an analysis at this point that shows there's been any additional overcharging. But what I think this has shown is that there are some problems with how the city is regulating how garbage rates are being set. And so Recology has basically said it's committed to some, but not all of the reforms to that process that have been recommended by the city.
And in regards to the city, is that the corruption scandal you're referring to?
So the city has basically proposed some reforms in response to issues that were exposed by the corruption scandal. And so now there's several proposals on the table for how the city can move forward. Recology has its own, where they're basically, like I said, they would implement some, but not all of the reforms, and they're asking the voters to potentially approve that down the line. The city is considering two other proposals. One of them is kind of a middle ground one that would include a little bit more than Recology's proposal. And the other one is a more aggressive proposal that could basically potentially break up a long-standing monopoly on trash collection that Recology has had and dates back to a voter-approved law from 1932.
Wow. Well, touching upon that, is there a second contender that is brewing and just waiting in the wings?
Not that I know of. Recology certainly has a grip on collection in the city. I mean, it's the provider for every home in the city right now. I think that it's just raised, this whole scandal has raised questions about whether or not that should continue to be the case for its critics.
20 seconds left. Kevin wants to know, with this $95 million overcharge, is this part of a bigger story, perhaps elsewhere in the country or in the state of California?
We don't know. I mean, quite frankly, though, Recology has an unusual relationship with the city that's just not the status quo in other places. Other counties put their garbage contracts out to bid and let other companies apply for work. San Francisco doesn't do that. It's had this structure in place for something like 90 years now that gives Recology its lucrative monopoly that's really allowed it to turn into this empire across the West Coast.
Wow. We'd really like to see how this all develops. Michael Barba from San Francisco Standard, many thanks to you. You just heard just one story from this publication. There are so many others that we do want to encourage you to check out. Let us know. We have links and more information on this original reporting at our website, abc7news.com. You can watch videos and also check out our ABC7 Bay Area streaming TV app. Stay with us. We'll be right back. Okay, Michael, I'm sorry about the hard out. We have a commercial break that we had to hit. Is there anything that we didn't get to in our interview? I know that you've been working. Have you been working on this for quite some time, I take it?
I have. Yeah, I've been working on, I mean, the Recology part of the scandal is really a central piece of the controversy. And I have been working on this for some time.
Yeah, and can you tell people, because I always think it's interesting that, people automatically assume journalists have all the answers to these things. Do you have a team that's working with you, or is this something that you single-handedly spearheaded and are working on by yourself?
No, pretty much nothing in journalism is done by one person. These stories are carefully combed through with my editors and other people here at the San Francisco Standard.
Yeah, and the response so far from the audience in response, because, I mean, this is an astronomical number.
Yeah, we're definitely hearing from people on social media, and yeah.
Okay, and where can people find you also? Do you have a handle that you'd like to share so people can follow you and your work?
Our website is sfstandard.com, and we're also on Twitter under at sfstandard, and personally, I'm at mdbarba on Twitter.
Very good. I'm sure we'll talk with you again. Thanks again, Michael.
Thanks so much.
Okay. And to everybody who is still on Facebook, once again, I can't thank you enough. A lot of positive feedback. Alex, thank you. I hope I am genuinely nice. Also to Kevin, glad we were able to get your question in today. And to Chad, he wants to say, I'll give you that the government is way too corrupted. That is a very loaded comment. I feel like we would need an entire program dedicated to addressing that comment of yours. So once again, thank you again. I'm Dion Lim TV, and please do like and share this post if you can. And we will see you also every day at 3 o'clock. Okay, back on the air in just about 5 seconds. Thanks so much for joining us for this interactive show, Getting Answers. We'll be here every day at 3 o'clock. I'm Dion Lim. We'll see you tonight on the news at 4. All right, we are clear from the air, but Facebook, once again, my gratitude for you tuning in. I hope to see you on social media as well. Like I said, Dion Lim TV. Have a great day, and Crystal will be back in this chair tomorrow at 3 o'clock. Cheers.